Welcome to my podcast. Today I'm going to talk about another common case that you can face in the clinical setting, and it has significant from the aspect of mammogram, and basically it's something when any lady receive her invite for the national screening for breast cancer. So basically, as we always agreed, double check the patient name and date of birth. Of course, after you choose yourself, the patient might come with certain concern that you need to address them wisely. So she might say that I read somewhere that any woman with heavy breast or dense breast more likely on the highest risk of breast cancer and those sort of things. So you need to alleviate and explain thoroughly, and of course with the nice guideline and the update in regard, you need to answer and address her questions. So I'll just brief about the dense breast. So it says like half of the women have dense breast, which make the risk of increasing breast cancer. And it's kind of hard to be picked up by mammogram because, as we all know, mammogram will look into anything that's white in the film or in the screen, and if the lady has dense breast, which means mostly either fibrous or granular gland, which will make the thing to be seen kind of challenging. And it means that it's not normal. Having a dense breast is quite normal and quite common thing can be seen, and it's not a medical condition at all. And usually it's referred like fibrogranular, and this will bring me basically to the three types of the tissue which compose a human lady breast. So it's basically composed of fibrous tissue, and this will hold the tissue together. And the second part, which is kind of functionality, is producing milk. It's the glands, so it's glandular. And of course, in between, which will fill up that gap, it's the fatty tissue. So in that regard, those kind of condition can be either hereditary or could evolve as we grow up and over the time, like for instance, around menopause. So it's either premenopausal or postmenopausal. And if the woman is taking hormone replacement therapy, and also it's been seen in those people who are lean and they have low body mass index, which means basically below 20. So women are less likely to have dense breast if she has gone through the menopause or had children already, or is taking anti-estrogen hormonal therapy like tamoxifen, which has been given to lower the risk of breast cancer, or aromatase inhibitor. And by that, they found that 10% of women tend to have fatty breasts, so it's quite soft, and 40% tend to have scattered density, which, as the name implies, so it's just scattered density here and there. And another 40% is heterogeneously dense, which means there's fibrous and granular tissue in a heterogeneous manner. And the last one is basically extremely dense and constitute with 10% who fall in this category. And it's basically, as the name implies, have large number of fibrous and granular tissue. So why this is important? As I said early on, it's kind of hard to pick up cancer cells, because usually cancer cells will show as a white spot or masses, and since the lady has dense breast, which is already white, So it's kind of hard to spot it. Like they say, it's hard to spot the polar bear in the blizzard. And mostly the cancer cell tend to grow, of course, in glandular tissue. So while fatty breast appears dark in the mammogram, it's kind of easier to spot any difference. However, in the dense breast, it's kind of challenging and hard. And this will bring us to the risk factor for developing breast cancer, God forbid. So if anyone has family history with breast cancer or other sorts of cancers in the body, or if they have genetic mutation, or if they has history, like for instance prior radiation, like before the use for chest, like for whatever the reason. And by that I mean if the lady was young and had in her age or adolescent. So they say that you can self-identify yourself and examine yourself in order to see and feel if you have a dense breast or if it's soft. And now they said that there is different ways whereby we need to tackle this or try to examine in more details in order not to miss any small one. So, for instance, if the mammogram, the traditional one, shows something suspicious, we can invite the lady for more ways of examining. Say, for instance, there's something called 3D mammogram, which is used by the radiologist to allow seeing the abnormal tissue in the liver and the breast. So it's kind of supplemental examination, and also there's the breast MRI and the ultrasound. And the breast MRI is basically with injecting of the dye for the blood vessel to stand out through the axilla. And also there is contrast enhanced mammography and abbreviated magnetic resonance imaging, which referred to be AB MRI, which is faster than the regular MRI. And also there is another thing called automated whole breast ultrasound, which is connotated in ABUS, which can pick up cancer cells when the previous just one mentioned did not, obviously. So basically the current UK national screening does not recommend any additional imaging unless the mammogram said otherwise. So if it's negative, it means they will not recommend that. So by that, I hope that I covered one area which is considered to be one of the important things not to miss. And I see you on another podcast. Thank you.